T waves aren't inverted. Oh, hey, you must be here to talk about amiodarone. So amiodarone, PSA or cortisone as it's also known, is a potassium channel blocker that's FDA approved and indicated for the treatment of life-threatening ventricular dysrhythmias that are non-responsive to other interventions. It has an off-label use to treat things like AFib. It's nice in the use of its treatment for AFib because it will not only convert but also maintain a normal sinus rhythm. So you may know that you're experiencing a dysrhythmia and that you may feel palpitations, lightheadedness, dizziness, or maybe even pass out. Those are times that you would want to seek out medical attention. So since amiodarone is a potassium channel blocker, one of the ways that it works is that it's going to delay the repolarization of the myocardium, but it's also going to decrease SA node automaticity. It's going to slow down AV node conduction as it travels from the AV node through the bundle of His, out through the Purkinje fibers into the ventricles. So it's also going to decrease peripheral vascular resistance. So you're going to get decreased force contractility as well as decreased frequency of ventricular contraction. So some side effects that you may experience while using this medication would be fatigue, hypotension, sleep disturbances. You may have some visual disturbances, nausea and vomiting, photosensitivity, maybe some blue-gray skin. Some things that you'd want to report to your physician right away would be the serious visual changes, weakness, needles and pins, heat or cold intolerance, and some neck swelling. So some dietary considerations would be to decrease your grapefruit juice intake, because this can potentiate the med and increase its chances for toxicity. And you would also want to not use it while you're using St. John's wort, because let's be honest, St. John's wort doesn't work well with anything. It has a black box warning, again, since it's used only for life-threatening ventricular dysrhythmias. That's the only time that you want to use it officially. So some nurse considerations would be that while you're using the loading dose of this medication for the first time, you're going to want to make sure that your patient's on a continuous ECG monitoring to see if there's any changes in cardiac activity. So let's talk about some toxicity, because this is pretty big. This medication is hepatotoxic. It's metabolized by the liver, but you're also going to possibly see some pulmonary toxicity associated with this medication as well. Should you have any further questions about amiodarone, its use, or contraindications, which would happen to be first-degree heart block, second-degree heart block, third-degree heart block, refractory bradycardia, and iodine sensitivity, anything else you want to talk about, you know where to find me.